How to prevent migraines. Triggers and avoidance. What exactly is a migraine? A migraine is characterized by a severe, pounding headache on one or occasionally both sides of the brain. Migraine headaches may continue for several hours or even days. Usually starting in the forehead, side of the head, or area surrounding the eyes, migraine gradually gets worse. The discomfort gets worse with almost any exercise, movement, bright light, or loud noise. During a migraine, nausea and vomiting are frequent symptoms. It could be difficult for you to accept that migraine is the third most prevalent ailment worldwide. Anxiety and depression are substantially more prevalent in migraine sufferers than in healthy persons, and the average person may experience a migraine attack for about 5% of his life. Fortunately, doctors and researchers have identified specific triggers that set off a migraine episode. In this video, we'll discuss a few of the very typical triggers that start migraines, and how you should regulate these triggers to help you manage your condition better. A proactive person may easily avoid these and effectively prevent a migraine. Before we begin this video, don't forget to subscribe to our channel for more daily tips like this. And turn on notifications so you never miss our new videos. Please be aware that everything discussed in this video is unbiased, verified with facts, and approved by licensed healthcare specialists before we proceed. In light of that, let's begin. 1. Stress. Stress is a well-known trigger for migraines. When you're stressed, your body releases stress hormones that can cause changes in the blood vessels and chemical balance in the brain, increasing the likelihood of a migraine attack. Emotional stress from work, personal relationships, or significant life events can all contribute to migraines. It's important to identify stressors in your life and develop effective stress management techniques, such as relaxation exercises, meditation, counseling, or engaging in activities that help you unwind. 2. Hormonal changes. Hormonal fluctuations can trigger migraines, particularly in women. Many women experience migraines associated with their menstrual cycle, known as menstrual migraines. The drop in estrogen levels just before the start of menstruation is believed to be the trigger. Some women may also experience migraines during pregnancy, postpartum, or menopause due to hormonal changes. Working closely with a healthcare professional can help manage hormonal triggers through appropriate medications or hormonal therapies. 3. Certain foods and beverages. Certain foods and drinks contain substances that can trigger migraines in susceptible individuals. Aged cheeses, such as blue cheese or cheddar, contain a substance called tyramine, which is believed to trigger migraines. Chocolate contains both tyramine and caffeine, both of which can contribute to migraines. Processed meats like hot dogs or deli meats often contain nitrates or nitrites, which are known triggers for some people. Foods containing MSG, a flavor enhancer commonly found in processed and packaged foods, can also trigger migraines in certain individuals. Additionally, artificial sweeteners like aspartame and the caffeine present in coffee, tea, and some sodas can be migraine triggers. It's important to identify any specific food triggers you may have through a process of trial and error, and make dietary adjustments accordingly. 4. Skipped meals or dehydration. Skipping meals or not drinking enough water can lead to migraines. Irregular meal patterns and fasting can cause fluctuations in blood sugar levels, which can trigger migraines in some individuals. Dehydration can also be a trigger, so it's important to stay adequately hydrated by drinking enough water throughout the day. 5. Sensory stimuli. Bright lights, flickering lights, loud noises, strong smells, and repetitive patterns can all be sensory triggers for migraines. These stimuli can overstimulate the brain and lead to migraine attacks in susceptible individuals. For example, exposure to bright or flickering lights from computer screens, fluorescent lights, or strobe lights can trigger migraines. Loud noises or certain sounds, such as loud music or crowded environments, may also act as triggers. Strong smells from perfumes, chemicals, smoke, or certain foods can be triggers for some individuals. Lastly, repetitive patterns or visual stimuli, such as driving long distances or watching certain patterns or movements, can provoke migraines. It's helpful to identify specific sensory triggers and take steps to minimize exposure to them when possible. 6. Changes in sleep patterns. Lack of sleep or significant changes in sleep patterns can trigger migraines. Both sleep deprivation and excessive sleep can contribute to migraines in susceptible individuals. Establishing a regular sleep routine and ensuring you're getting sufficient sleep each night is important. Creating a sleep-friendly environment, practicing good sleep hygiene, and managing any underlying sleep disorders can help prevent migraines triggered by changes in sleep patterns. 7. Weather changes. Weather fluctuations, particularly changes in humidity, temperature, or barometric pressure, can trigger migraines in some individuals. Although the exact mechanism is not fully understood, it is believed that these weather-related changes can affect the chemicals in the brain and the blood vessels, leading to migraines. Some people may experience migraines before or during storms, for example. Others may be sensitive to changes in temperature or humidity. While you can't control the weather, you can be aware of its potential impact on your migraines and take preventive measures. This may involve staying indoors or in a controlled environment during extreme weather conditions. Using air purifiers or humidifiers, wearing appropriate clothing to regulate body temperature, or using sunglasses to reduce exposure to bright sunlight. 8. Physical exertion. Intense physical exertion or sudden, strenuous activities can trigger migraines, especially in individuals who are prone to exercise-induced migraines. It is believed that physical activity can lead to changes in blood flow and the release of certain chemicals in the body, triggering a migraine attack. To prevent exercise-induced migraines, it's important to warm up properly before engaging in strenuous activities. Stay hydrated during exercise, and gradually increase the intensity of your workouts. 9. Medications and caffeine withdrawal. Certain medications, such as vasodilators or hormone therapies, can trigger migraines in some individuals. Additionally, abrupt caffeine withdrawal can also be a trigger. If you suspect a medication is triggering your migraines, consult your healthcare professional for possible alternatives. If you're trying to reduce your caffeine intake, do so gradually to minimize the risk of withdrawal-induced migraines. Migraine prevention involves a combination of identifying triggers, making lifestyle modifications, and, in some cases, utilizing medications or other treatment approaches. Here are some strategies commonly used for migraine prevention. Identify and manage triggers. Keep a migraine diary to track potential triggers and patterns. By identifying your individual triggers, such as specific foods, stressors, or environmental factors, you can take steps to avoid or minimize exposure to them. Establish a regular sleep routine. Aim for a consistent sleep schedule, ensuring you get enough sleep each night. Maintain a relaxing sleep environment, practice good sleep hygiene, and consider strategies like using white noise machines or earplugs to promote quality sleep. Manage stress. Since stress is a common trigger for migraines, finding effective stress management techniques can be beneficial. This may include practices such as relaxation exercises, meditation, mindfulness, yoga, or engaging in enjoyable activities that help reduce stress levels. Maintain a healthy lifestyle. Adopt a healthy lifestyle, including regular exercise, a balanced diet, and staying well hydrated. Engage in moderate aerobic exercise for at least 30 minutes most days of the week, eat nutritious meals, and drink plenty of water throughout the day. Limit or avoid trigger foods and beverages. Be aware of foods and drinks that have been identified as potential triggers for migraines, such as certain cheeses, chocolate, processed meats, MSG, caffeine, and alcohol. Consider reducing or eliminating these triggers from your diet to see if it has a positive impact on your migraines. Consider supplements and alternative therapies. Some individuals find relief from migraines through supplements like magnesium, riboflavin, vitamin B2, and coenzyme Q10. Alternative therapies such as acupuncture, biofeedback, or cognitive behavioral therapy, CBT, may also be explored under the guidance of a healthcare professional. Medication options. If lifestyle modifications alone are insufficient, your healthcare provider may recommend medication for migraine prevention. Options can include beta blockers, antidepressants, anti-seizure medications, or CGRP, calcitonin gene-related peptide inhibitors. The choice of medication depends on individual factors and should be determined in consultation with a healthcare professional. Discuss preventive treatments with your healthcare provider. In some cases, if migraines are frequent, severe, or significantly impacting your quality of life, your healthcare provider may suggest specific preventive treatments tailored to your situation. These may include Botox injections, nerve blocks, or other procedures. These interventions are typically reserved for individuals with chronic or severe migraines. It's important to note that not everyone will have the same triggers, and individual triggers can vary widely. Keeping a detailed migraine diary can help you identify your personal triggers by tracking your activities, food intake, sleep patterns, stress levels, and environmental factors before each migraine episode. This information can be valuable in developing a personalized prevention plan with the help of a healthcare professional. Remember, while identifying triggers and making lifestyle adjustments can help prevent migraines, there may be additional factors contributing to your migraines. Working closely with a healthcare professional who can provide a comprehensive evaluation, offer appropriate treatment options, and develop a personalized management plan for your migraines is always recommended. As always, we care about your health. If you enjoyed watching Vital Health TV and learned something from this video, please hit the like button and subscribe to our channel for more videos like this. Engaging in the act of subscribing to and sharing our posts is a commendable deed, as you never know when this valuable and transformative information might be of great significance to someone in need. Thanks for watching.